All right. Good morning, everybody. So no better day than a Saturday morning to talk about everything you ever want to know about your gut and more. So I'm Angela King. For any of those of you who don't know me, I'm the owner and clinic director in neuroacupuncture and functional medicine. And this is Chelsey Dodd.
Hi everyone, I'm an acupuncturist here with a master's degree in nutrition and have enjoyed working here for about 8 years.
Yes, so we are going to delve right in because we have a lot to cover today with the gut. So what we wanted to do with this talk is really to structure the talk around helping you guys to understand exactly why you might be hearing the word gut microbiome more than you've ever heard it before in your life, and why it's so important to your overall health and wellness. So the gut, we hope by the end of this talk, we have really, instilled in you how important the gut microbiome and the status of your gut microbiome is to your overall health and wellness. So we're gonna let Chelsea's gonna start with a basic just intro, and then we're gonna dive right in. And again, if you have any questions, hi Facebook. So if you have, and please, I wanna say this one thing. If you're on Facebook Live or Zoom and you haven't liked our Indian Acupuncture and Functional Medicine page, we're still learning how all this social media stuff works. And apparently, it's important when people like your page and they comment and they like your posts and things like that to help us be able to reach more people. So if you guys wouldn't mind taking a moment to do that, we would certainly appreciate it. So, and we appreciate you watching. All right, we're gonna get started.
Okay, so the microbiome is the magical world within, your whole little microenvironment inside. It's hundreds of bacterial species, 10 trillion microbes that are inside your gut, about 6 to 10 pounds on average. So a good portion of you, and they have a huge impact on how you feel and how your health is. We have beneficial bacteria, these are the guys that help us out. Opportunistic bacteria, these are the ones that take advantage when there's space to take advantage. Pathogenic bacteria, they're the ones that make us feel crummy, create toxins, cause disease. Yeast, that are mostly bad, some are good, and mold. And these guys, their ratios and what they do inside your gut is a huge determinant of your health and your risk for a lot of different diseases. So how do we get them? We're beginning the establishment of the microbiome in utero. So it starts there. Another big step is the process of birth. It's different whether you have a vaginal birth or a cesarean, different bacteria present in the birth canal colonize during birth, or bacteria on the skin and the environment during a C-section. After birth then becomes the first 3 years where the microbiome really gets stabilized. It's sort of in flux through that first 3 years. So whether you breastfeed, formula feed, huge impact on the microbiome, what foods and bacteria you're exposed to in the first 3 years. There is a hygiene hypothesis that was started in the late 80s, and the thought was if there's too little exposure to bacteria, the microbiome cannot develop normally. So then that creates a lifelong health impact, from early childhood allergies and eczema and things like that to later issues that we'll talk about. So the first 3 years are very important in terms of what you start with your microbiome. The good news is you can always change it through time, but that's the start. So to some extent, you get a lot of your mom's microbiome, and a lot of things that maybe were connected to genes could actually be a pass of one microbiome to the next, from mother to baby. So it's become a hot topic of research in the last 10 years because of its importance. And more studies show the makeup of your microbiome affects almost everything, from your mental well-being to your physical well-being to your risk for diseases that were previously not well understood, like certain cancers and autoimmune diseases.
Right, so we're going to give you next 6 hot areas of research where you could get lost like I do, reading journal article after journal article about the connections between the gut microbiome and the bacteria in the gut microbiome and the rest of the body. So we picked the top 6 areas that we're interested in and that we think relate to most of our patients. Hang on, got a zoomer. Okay. So that we think are beneficial to most of our patients, right? And so the top 6 areas that we're going to cover are the links between your gut and your immune system, your gut and your lungs, your brain, mental health, metabolic issues, and cancer. Okay, so I'm going to start talking about the gut and the connection between your immune system. So like Chelsey just told you, a lot of your gut microbiome is seated at birth, right? But not only is your microbiome seated at birth, because of that, a lot of your immune function is also. So we have ways to influence that and change it, but what happens in your gut microbiome directly affects the function and the efficacy or the efficiency of your immune system function. So the gut, as we talked about in our immune resilience talk, has its own sort of immune system, if you will, through the barrier lining of the gut called the Gut Mucosal Barrier. Okay, so Secretory Iga is present there. That's SIGA. And Secretory Iga is an immunoglobulin, okay? And it's the first line of defense against invading pathogens. So you need to have a healthy gut mucosal layer in order for that IgA to be able to do its job well, right? So when the IgA is low or depressed, then pathogens have a much easier time of infiltrating and getting deeper into your system. So also, gut bacteria actually modulate neutrophil infiltration and function, right? So your neutrophils are your white blood cells that help fight bacteria, and gut signals, gut communication from these particular bacteria drive that neutrophil to do its job. Gut bacteria also create something called colonization resistance. And colonization resistance is a function of the gut that keeps other microbes from being able to adhere and stick and penetrate more deeply. So the gut bacteria are the ones that are making that happen. Also, there's a huge, just so much research on gut and autoimmune disease. So if any of you out there are suffering from an autoimmune disease, and the most common ones that they are researching and finding direct links between specific bacteria in the gut, like specific species of bacteria in the gut, Klebsiella, Citrobacter, Pseudomonas aeruginosa, these are just a few of them, these are just a few of them. They're finding direct correlations between the levels of those bacteria in your gut and the triggering of certain autoimmune diseases, such as rheumatoid arthritis. There's also between ulcerative colitis and Crohn's disease, type 1 diabetes, psoriatic arthritis, all of these. So not only can the bacteria overgrowth in the gut trigger the start of those, they also have a lot to do with the progression and the ability for that person to maintain that autoimmune disease in a relatively balanced state. So let's say maybe by the time it's already triggered, maybe we can't go back and completely reverse it, but you can modulate the progression of it and the intensity of it by regulating your gut. So now let's talk about the gut-lung connection. So this is of importance right now, especially the gut immune system, or the gut and its effect on the immune system, and the gut microbiome and its effect on the lungs, because everyone's, had concern about COVID, right? So there is actually a term in medicine called the gut-lung axis. So the gut-lung axis is actually this, it's how the microbiome of the gut and the microbiome of the lungs actually talk to each other. So it's only in recent research that the term lung microbiome even existed, but it does. And so it's how the bacteria in your gut can influence respiratory disease. Okay, so how this happens, there's a pathway called the mesenteric lymphatic system. Okay, and this is a pathway between the lungs and the intestine. So bacteria and their metabolites, like short chain fatty acids, can cross over that gut barrier and modulate the lung immune response. So short chain fatty acids, I threw that term out there real quick. Hang on, Lisa, we got low battery on the iPod. Yep. Okay, so sorry about that. The short chain fatty acids in the lungs are signaling, they act as signaling molecules, and they can attenuate, which means sort of modulate or drive down inflammatory and allergic responses. So these short chain fatty acids can act as anti-inflammatory and also reparative, right? So we want, it's so important how the gut bacteria can do this and affect the lung health, right? So there's a quick little research study I thought was interesting where they used animal studies with mice, okay? And they infected these mice with the influenza virus, all right? Well, so here's what happened. They gave the infected mice with the influenza, they gave them antibiotics. All right, now we all know that antibiotics don't do anything to treat viruses, but how commonly do we go to the doctor even when we have a viral infection and we want some kind of relief, and if it's through an antibiotic and the doc gives us one, we take it, right? So this is not at all uncommon that hold on one sec. It's not at all uncommon. I think we're going to be okay here in just a second.
It wouldn't be a talk without a technical.
Oh yeah, I mean seriously, like if we can't have at least one technical difficulty per talk, we're not doing something right. Okay, so hopefully we got it all taken care of. But okay, let's go back to these mice. It's super important. So they infected the mice with influenza. All right, then they gave them an antibiotic. Well, what does an antibiotic do? It disrupts their gut microbiome and kills all the good bacteria as well as any bad bacteria, but it's definitely disturbing the gut microbiome by killing off the good healthy bacteria in the gut. So the mice that got the antibiotic showed a significantly reduced immune response against the influenza virus compared to the ones who did not get the antibiotic. So that just goes to show you what's happening in the gut can affect the your progression of an acute respiratory illness. So they also did another study where mice infected with influenza, okay, and they gave the experimental mice, they fed them a high fiber diet, okay, while they had the influenza virus. Why a high fiber diet? Okay, why would anybody want to eat high fiber when they have the flu? All right. Well, they gave these mice a high fiber diet because the fiber, the fermentation of the fiber in the gut produces more short chain fatty acids. And we just talked about how important those were for signaling, right? So these mice that were given the high fiber diet survived the influenza infection, much greater survival rate than the controls. So just thinking about that now, I hear everyone so concerned about social distancing and wearing a mask. And I see all kinds of things on Facebook all the time about how we're losing our immunity because we're going to wear these masks and on and on and on. I would tell you this. If you weren't concerned about your immune system before now, the wearing a mask for whatever period of time is going to have a much less impact on your immune system than what's going on in your gut. So what you should really be concerned about is fixing your gut and knowing what's going on in your gut, because that is what's going to have a immediate and long-term effect on your lung function and your immune function. So,
and a fun fact is, long ago, the Chinese connected lung and large intestine are pairs. So
in the organ systems, the metal element. Okay. So gut-brain axis, all right? Again, I could do like an entire talk on just the gut and the brain, but let me pare it down to just a few important items, okay? So the gut-brain axis, that's another actual medical term, the gut-brain axis. So we have the gut-lung axis, the gut-brain axis. So there's a direct link from the gut to the brain through one of your cranial nerves called the vagus nerve, okay? So, and this vagus nerve, it has a bidirectional communication from the gut. That means the gut bacteria signal, they communicate through the vagus nerve up to the brain, and the brain, there's things going on in there and signaling and sensory information, and it's connected and it gets back down to the gut, right? So, I mean, have you ever felt anxious and had butterflies in your stomach, right? So what's going on, in your emotions also affects your gut through that connection. So basically there's some really interesting, the vagus nerve itself actually regulates gut motility. It activates gut motility. That's like the impulse that you need for your intestines to move to go to the bathroom. Okay. The vagus nerve is involved in the release of digestion enzymes. It helps control blood flow to the gut. and is responsible for bowel constriction and control as well. So there's three really hot areas of research right now between the gut and the brain. One is traumatic brain injury patients. So at one of the University of Miami conferences I went to on integrative medicine, one of the doctors, Datis Karazian, was speaking. He's done so much research and actual experiments in this area. He's associated with Harvard, really brilliant guy, right? So he works with a lot of traumatic brain injury or TBI patients. So what they found is immediately after a TBI, it's within a matter of hours that it could be a spinal cord injury, it could be a mild traumatic brain injury, the degree didn't matter. The gut microbiome is automatically affected. And the changes in the gut microbiome predicted the degree of locomotor impairment. So how messed up the gut became essentially, and what pathogens and bacteria started to overgrow there, and whether or not they regulated that had a direct influence on the person being able to get some motor control back and things like that. So they're actually now using probiotics and targeted gut therapy in cases of traumatic brain injury and seeing a lot of improvement. So much research out there on that. Just if you're really interested, you can Google TBI and gut microbiome and just read to your heart's content, right? So another one that I think more of us might be concerned about or relatable to, because we maybe had someone in our family or concerned about it, but there's a huge topic of research between the gut microbiome and Alzheimer's disease. Okay, so a different conference I went to, we looked at images of slides of brain tissue, neural tissue of deceased Alzheimer's patients. And what this one particular study, and again, this is out there in the literature, they're seeing is that the plaques, everyone kind of vaguely familiar with that idea that in the brains of Alzheimer's patients, they get these plaques, okay? They were able to isolate candida, which is a yeast, from these plaques. So candida most likely originates in the gut and has crossed that blood-brain barrier that's supposed to keep things out. Like the gut barrier is supposed to keep things out. We have a blood-brain barrier that's supposed to keep things out too. And so this candida can get in the brain and can be associated with these plaques. So there's a lot to delve into about that, but certainly those of us who are concerned about a parent who had Alzheimer's or something like that, it's really, really important to look at your gut now, not when it's too late, let's say. Okay. And then another one, which you may have a family member know, is Parkinson's disease. So you can read so much about this as well. It's the link between the gut microbiome and the development and triggering of Parkinson's disease. It has to do with the production of something called alpha-synuclein. It goes to the basal ganglia and the substantia nigra, and it has to do with dopamine, and there's a whole cascade of things that happen. But just know that the early signs of Parkinson's disease are not a tremor. All right, that happens later. The early signs of Parkinson's disease have to do with loss of smell and loss of GI motility. Chronic constipation is a huge warning sign for Parkinson's disease. Loss of that GI motility, then that can turn into a loss of taste. You'll often hear people say that food just doesn't taste good anymore, or they don't want to go out to restaurants to eat, or no restaurant can cook any food really well. There's so many of these early warning signs for Parkinson's disease, and we can determine whether there's a risk factor there or not by looking and measuring the gut microbiome. Okay.
Smell and taste with dementia too.
Smell and taste and dementia as well. Yeah, absolutely.
Okay, so along that gut-brain axis as well is our mental health and well-being. In addition to the vagal nerve communication between the microbiome and the brain, there's also an alteration in cortisol, which is a stress hormone. And then, surprisingly, our microbes actually produce neurotransmitters. And if you guys have heard of neurotransmitters, they're the brain chemicals that determine a lot of how we feel. So it can be when we feel excited, when we feel focused, when we feel determined, when we feel relaxed, when we feel anxious, when we feel on edge. So neurotransmitters have a huge impact on how we are feeling in terms of our well-being. So direct production by the microbiome. The first one is Gaba, And GABA is an inhibitory neurotransmitter that helps you relax. It's how you initiate sleep. It's how alcohol works. It's how Valium works. If you don't have any, you're going to have sometimes difficult sleeping, being on edge. Your gut's responsible for a good percentage of your production of that neurotransmitter. Dopamine's another one. Dopamine gets you up and going, gets you focused, gets you motivated. That's how cocaine works on the dopamine receptor. So your gut also responsible for a large percentage of dopamine production. And norepinephrine, which is a portion of adrenaline, sort of makes your heart beat fast, regulates where the blood's going. So you depend on your microbiome for a large production of that. And when you take medications that affect levels of those hormones in your brain, that feeds back to the gut as well. So there's like a sort of a cycle there of communication. And then, although they don't directly make it, the microbiome influences through communication your levels of serotonin. And serotonin is your feel-good, joy neurotransmitter. SSRIs are one of the most commonly prescribed medications. They affect your levels of serotonin in your brain.
Antidepressants, yeah. Like Prozac, Wellbutrin, all of Zoloft, that Lexapro, that whole category of drugs.
So how your microbiome is producing neurotransmitters, whether they're producing enough of not enough of one, too many of another, what's going on in there, could have a direct impact on how you're feeling in terms of development of depression, anxiety, difficulty with sleeping, ADHD, even autism, and your perception and ability to manage pain levels.
Yeah, so when I was reading about this too more in depth, there's actually a term that they're using now, a field called psychobiotics. So what that means is that they're actually using these types of supplements that we're going to get into, and probiotics and things like that regulate the gut to help deal with mood issues like anxiety and depression. So that term psychobiotics is actually a real thing. Yeah.
Okay, so the next hot area with your gut is obesity, inflammation, that spectrum of things. So like the psychobiotics, we also have something related to the microbiome called the obesity signature. So there is a certain imbalance or alteration or few within the gut that is known to create obesity, or an obesogenic microbiome is called. So a lot of the stuff we've had difficulty explaining why one person can eat a relatively balanced diet and enjoy some splurges and maintain a healthy weight, while someone else who seems matched in many other ways eats one piece of cake and gains 5 pounds or falls off the wagon, or it's hard to define why some people are successful in weight loss and some aren't. And this may be one of the reasons. When you have the obesity signature, it's very difficult to lose weight, and it's harder to bounce back when you've fallen off the wagon. Yeah. So one of the really interesting animal studies I came across that really highlights this, they took normal weight rats with a normal microbiome, and then they took obese mice, with the obesity signature, or the obesogenic microbiome. And they took some poo from the obese mice. This is called a fecal implant. It's a lovely idea. So they took some of the stool contents and put it inside the normal mice, the mice that were of normal weight with normal appetites. Within weeks, there was a huge change in the appetite of the normal mice, and within a few months, they had reached the weight of the obese mice, just from a fecal implant. So there was a change in the microbiome from these pathogenic microbes that changed the appetite, changed the body composition within months. And that's huge. That was the only change.
So just as a comment on that, I was reading more about that yesterday as well. And I found one study that they did that, and they said the microbiome, like the actual composition of the bacteria and stuff in the microbiome, started to change within an hour. And in those mice, I mean, who knows why, but within 2 weeks they were obese.
Wow.
So it can happen so quick, whether it's weeks or months though. It's like these were we just want you to understand that these were like normal mice, right? They had no issues regulating their weight, their appetite, their cravings, nothing, right? And when they were given a fecal transplant from mice who were obese, right? They took the stool from the obese mice and implanted it into the normal mice. The normal mice became obese, right? Had nothing to do with food. right? It was their it was the gut microbiome obesity signature from the obese mice, right? So it's so important if you have weight issues or obesity to really truly look and fix your gut microbiome.
And why might that be? There's been a couple of different ideas, and one explanation that's simplified may be that everything that's alive has a instinct to survive. So these pathogenic microbes come in that thrive on sugar or simple carbohydrates or whatever. We already know they can alter your neurochemistry, so they can change the types of food you're craving and your appetite to flourish and survive. And then it also goes back to, we keep talking about these short chain fatty acids. The good bacteria ferment those short chain fatty acids, and that creates satiety and decreases appetite. So the bad guys are fermenting and creating different metabolites that don't give you that satiety and don't decrease your appetite. And then the other thing about the harmful microbiome players is that many of them secrete enterotoxins, which are very inflammatory. So the inflammation builds in the gut and then eventually becomes systemic, and then that creates an inflammatory environment, which creates obesity in another part of that vicious cycle. So after we're speaking about inflammation, the next link would be to microbiome alterations and cancer risks. So there's been tons of research as well here and alterations in the gut microbiome to increase cancer risk, the most studied being colon cancer, breast cancer, liver cancer, also now a lot more with pancreatic cancer, and I'm sure the more research that's done, the more connections that they're going to find. So originally it was thought that this was simply an inflammation link, that the alterations cause systemic inflammation. We know inflammation increases cancer risk, but now they're finding more precise things about the microbiome in terms of promoting a tumor environment versus suppressing a tumor environment. So they call some microbiomes and the short chain fatty acids as anti-tumor effects, meaning that they actually recruit parts of your immune system that's vigilant for cancer cells that can eat the cancer, stop the cancer, change the environment so the cancer can't flourish, versus part of the microbiome that promote inflammation and provide the cancer the things that it needs to grow and take hold and hide from the immune system that would fight it. So one of the things that they're now also seeing is that tumor cells have their own microbiome, and that's really important in prognosis for things like pancreatic cancer. So they found on the tumors of pancreatic cancer there were different microbiome signatures, and which microbiome signature was present was more than 90% predictive of how well these patients would respond to certain types of treatment. So as research goes on, they're going to attempt to use the microbiome on the tumors to improve maybe treatment outcomes for some of these cancers where the success rates are so terrible. So one thing I would take away from all that, and like Angela said, there's a day worth of stuff we could talk about here, but we're trying to hit the highlights. But basically you have the power to reduce your cancer risk if you do everything you can to get the healthiest microbiome, because they're going to help you so much to fight off these cancer cells as they come and keep the environment and the immune system as good as it can be.
Okay. So I'm looking at time, and I'm thinking like we want to get into the testing. So we have like the top 6 factors that affect the gut microbiome. And what's interesting is when we were writing these last night, we were also realizing how similar these factors are to the same factors that affect your immune resilience. Okay. Yep. So we're maybe not go as deep as we were planning on to about this, so we can get into the testing. Okay. But the top 6 factors are diet, obviously what you eat, no surprise there. Stress, age, medications, toxins, and infections. So maybe let's just like good take home point about diet, and we'll just kind of try to go through that quickly, and then the next part we'll get into the testing. Okay, so I'll try to be real quick. The standard American diet, you guys know, prevents the healthy microbiome, the healthy bacteria from flourishing. So processed food, processed meat, all that is the worst. Beneficial, hands down, is high levels of fiber. So even diets like keto diet, paleo diet, where those types of fibers are limited, can have a negative impact on the microbiome. Prebiotics feed the beneficial bacteria. Those are inulin, FOS, chicory, you may have heard of it. Dietary sources are
burdock, asparagus, oat bran, wheat bran, beans, onions, leeks. You can Google prebiotic foods. There's a lot out there. Studies showed that vegetables, legumes, moderate protein intake, and lots of dietary fiber is the best to feed the microbiome.
Okay, so stress. We all know that there's a direct relationship between stress and the microbiome. So if we feel stressed, we have unresolved issues, we're walking around worried, frustrated, maybe it's family issues, maybe it's work issues. It's stress is like your experience of when your capacity to deal with whatever's on your plate is exceeded by those demands, right? So your reservoirs are low, you're stressed, you're burnt, you're walking around with, those types of unhappiness, discontented feelings all the time, right? That is what your perception and your experience of stress is. So, and now we're going to have a whole epidemic of post-traumatic stress because of COVID. And so we have to understand, though, that this weakens the immune system and it directly changes the gut microbiome, right? So stress depresses the secretory IgA that is found in the lining of the gut mucosa. That does not allow you to fight off toxins and bacteria and pathogens anymore. So stress, you definitely want to work on that and use some resources for that, which we'll talk about in a little bit. So stress definitely changes the microbiome.
Medications are another huge impact to the microbiome. I'm going to try to run through this quickly. They went through about 41 different classes of medications. Many of them affect the microbiome, but the top we'll go over. PPIs, which is for GERD and acid reflux, which ironically you're taking because your microbiome is off.
Right.
Now
you're taking Nexium, Prilosec,
Now you're taking those and you're making things worse, so it's back into the vicious cycle. That increases upper GI issues, so like the hardest things to deal with, the SIBOs, and it affects and decreases your short chain fatty acids, which you need for the microbiome. So trying to get off those is hugely important. Metformin, which is used for elevated blood sugar, increases E. coli and insulin resistance. On the metformin. Antidepressants, especially SSRIs, alter the microbiome. Oral steroids are one of the worst. Immunosuppressant really devastates the microbiome and causes methane gas, the tooting bacteria, to increase, and constipation. Antibiotics, depending on the broad spectrums, are the worst. They go through and kill off most of the good bacteria, and then without vigilant repopulation, the opportunistic and the pathogenic guys are going to take hold. Hormones, there's a huge connection between oral contraceptives and inflammatory bowel disease, and even sometimes hormone replacement in menopause, if it's not done very carefully, can alter the microbiome. And laxatives. So even a short but intense bout of diarrhea, if you use laxatives regularly to control constipation, you can be flushing out the good guys you have left there and then making things worse and worse over time.
So also toxins. So these can be chemical toxins, disrupt the microbiome, glyphosate. You may have heard about that with all the issues with Monsanto and Roundup and being in your, Quaker Oat cereal. That's definitely something. Genetically modified organisms or GMOs can disrupt the microbiome. Also, another toxin that we don't necessarily really think about as a toxin is alcohol. So there's so many studies on alcohol and alcoholics and their gut microbiome. And one of the worst things about it is that 90% of alcoholics have small intestine bacterial overgrowth, which is called SIBO. And when you combine SIBO, that's a whole different talk, but it's where the bacteria that are supposed to be in the colon, they translocate up into the small intestine instead. These people typically have bloating after they eat as a major symptom, and they have a lot. And when you have this small intestine bacterial overgrowth and you combine it with the toxin of alcohol, too much alcohol, it really, there's so much research, it really quickens the process of neurodegeneration. So these are people that will definitely be at a much higher risk of dementia, possibly Alzheimer's or other neurodegenerative diseases like Parkinson's, MS, those sorts of things. And then certainly infections disrupt the microbiome. So this leads us into testing, all right? Infections are usually overgrowth of bacteria, parasites, or yeast. And the source can most commonly be from contaminated food or undercooked food, undercooked meat, things like that, sometimes sushi, or contaminated water, contaminated drinking water from a water fountain, or even from swimming in swimming pools or lakes or ponds or things like that. There's all kinds of ways that infections can get into your gut microbiome, also through animals and pets sometimes. So there's all these different ways. So when you have these infections, they're ubiquitous. We just have to discover them and know what to do to treat them. So you could have symptoms what would lead you to microbiome testing? Well, hopefully we've made you understand that it's for your overall health and wellness. It's something people can even do proactively, right? To obviously reduce their risk of all these issues that we've already been talking about. But if you are symptomatic, okay, if you have symptoms, and they fall into any of these categories, that would be a reason to seek out testing for your gut microbiome as well. So this is far beyond, like, of course there's going to be acid reflux symptoms, could be need a microbiome test, or bloating, constipation, diarrhea, irritable bowel syndrome, Crohn's colitis, given, all right? But mood disorders, anxiety, depression, right? Those could be a reason to test your microbiome. Allergies, brain fog, big one. Memory issues, like, starting to notice that you're not as sharp anymore, and it seems like you're too young for that to be a problem, right? Or certainly like sinus congestion. There's a huge link between chronic sinusitis and the gut microbiome. Allergies, big time. That's why, like, when you have a respiratory infection and maybe your natural health provider says take a probiotic, there's a reason. Also allergies, acne, huge reason to test your microbiome if you have acne, or your child does, or your teenager. So any type of neurological issues, headaches, there's just the whole gamut of reasons.
Chronic pain,
because of the inflammation connection, right? Or any of those autoimmune diseases we talked about, absolutely should have gut microbiome testing and treatment. So
and women's health also, we're not going to get into
women's health, whole nother field. Oh my goodness. Recurrent vaginosis, yeast infections, things like that, all kinds of things for women's health.
PCOS,
polycystic ovarian syndrome, dysmenorrhea, the list goes on. Okay, so what is a gut microbiome test? All right, the one that we are using, and we've used a couple in the past, but for right now, this test is extremely comprehensive, and it hits not only the infections, but it looks for microbes, but it looks at digestion, absorption, inflammation, and immune function. And this particular test is by Diagnostic Solutions Lab. It's called the GI map. And if you Google that, you can look up the white paper about their methodology. They're a CLIA certified lab. And the methodology that they use, I do want to just mention that because it's important as to what separates this from some of the older tests out there. So the older tests used to be culture tests. So you would give a stool sample and they would grow it out in culture, and they would report, either the presence or absence of certain bacteria, yeast, and fungi, like on a positive, negative type basis. Well, but with no real quantification, okay? So what this methodology does is let's walk it through, right? Okay. So you pick up a kit, it's done at home, all right? And
you may or may not order a toilet hat on Amazon.
Well, we actually have toilet hats here in the office for anyone that would like them, because otherwise it comes with a
French fry holder.
We'll call it that.
And you may not look at your French fries the same again,
yes.
Which may be a good thing.
Yeah, that's a little hard for most people. So a toilet hat we recommend that. It goes in your toilet seat, right? And you have your bowel movement, okay? And then you have this little container that looks like a pill bottle, and the little cap has a little shovel on it for the end. And
I used a plastic spoon at first until I knew there was a shovel, and the shovel is much better.
Okay, so learn from her mistakes. We've both done this test, so we can speak from personal experience. And then you sort of, the fun part, you are giving us, so you're getting a couple of areas of the stool you want to get inside, so that we get really what's really in the microbiome, and you just put it in the little container that's got some solution preservative in it, and you shake it up, you put it in your FedEx bag, they come pick it up, See it later. All right. So it's an at-home stool collection. Other than just not being like the most pleasant thing to do in the world, the process couldn't be easier. Okay.
And you only have to do it once, which a lot of the older tests
yes.
you have to do it like
a lot of the
times.
older tests you had to do it at like a few 3 days in a row. Okay. So it's one collection sample. It uses real-time PCR methodology. That's what's also important to know. So what that means, you may have heard, you may be more familiar with PCR, that term, than you ever were before COVID or coronavirus, because that's what they do if you get sick. The swab up your nose, it's a PCR test, because PCR tests for the DNA. In this case, the DNA, and COVID's different. They're looking for RNA of that virus. But in this test, they're looking for the DNA of these particular microbes. So fungus, yeast, bacteria, right? And they're able to quantify per gram of stool what is most likely being contained in your gut microbiome. So it's much more accurate. And we've seen that in terms of husband and wife getting tested and both having the same parasite, likely because they ate the same food, where the lab had no idea that these people were husband and wife. We've just seen retest validated. It's really sharp methodology. So the one also, Medicare covers this test 100%. So that is great for anyone out there who does have Medicare, because the test is covered 100%. The other good thing about that is Medicare doesn't just, cover labs that are useless, right? So they have to meet really good criteria. They're CLIA certified. And so that this test is covered by Medicare. Now, if you are a regular insurance patient, the test, we're going to talk about fees just so everybody kind of knows what they're looking at. We're completely transparent about all that. These are the lab fees, has nothing to do with us. The lab requires, for regular insurance, Blue Cross Blue Shield, United, whatever, they require like a $208 down payment, whatever. And then they bill your insurance. And if your insurance pays, that's it. You don't owe them anymore. If your insurance completely denies the test, then you make up the difference between $208 and $423, which $423 is the out-of-pocket cost cash cost for the test if you have no insurance, or if you're paying cash. Okay. The turnaround time for the test is 5 to 7 business days after you submit. So it's one of the ones that we get back very quickly, very reliably. And we also have great clinical support there in case we find something unusual in your test and we want to ask a doctor. We're able to get real-time, really good support. So let's look at what the test covers. So the components of the test, we're going to start with the infections, or the dysbiotic bacteria that this test tests for. So it looks at 17 different pathogens. All right, pathogens are microorganisms that are known to cause disease in humans. Okay, so examples of what this test tests for is C. diff toxin, A and B. If you guys have heard of C. diff, it can cause severe diarrheal disease in people, but we've learned that people can be carriers of C. diff and not know it. So that means that they're not suffering from acute C. diff diarrhea or illness, but they're carriers of it, and we want to be able to, get rid of that, because nobody needs to be carrying C. diff around. But it also looks at some of the things like Salmonella, Shigella, E. coli, and then some of the more pathogenic parasites like Cryptosporidium, Giardia, and Entamoeba histolytica.
And you may think you have these if you have them, but at certain low levels they may be creating alterations or inflammation and not causing like the acute violent symptoms that you would expect with those kinds of infections. Right.
So also it tests for H. pylori, and H. pylori is a bacteria that lives in the stomach. Okay, so if they find it in the stool, it's really significant, because it means that its DNA has survived transit all the way through, from the stomach through the small intestine, the large intestine, and out into the stool. So H. pylori is a big deal. The estimate is about 50% of the world's population has been infected with H. pylori, but H. pylori, having the presence of that in your stomach, especially if it has certain what's called virulence factors. Okay, so these bacteria can have certain virulence factors that are either turned on or turned off. If they're turned on, it greatly increases your risk for gastric cancer and even pancreatic cancer. But other types of H. pylori infections will give you acid reflux, GERD, gastroesophageal reflux disease, and gastric ulcers as well.
Meanwhile, lowering your stomach acid.
Oh, yeah. Oh my God, that's a whole talk right there. So having H. pylori lowers the production of stomach acid, which, think about this, stomach acid is so important, not just to break down your food. That's what most people think, right? But hydrochloric acid is one of the things that also kills these bugs at the upper level of your GI system, so they don't make it down into your small intestine, they don't make it down into your colon, right? So not having enough stomach acid is a real problem. That leads to lower production of secondary bile acids, which prevents the good nutrients from being absorbed into through your small intestine. So H. pylori, bad. We definitely want to treat it if it's there. Then this test looks at 26 opportunistic infections. Okay, what does that mean? These particular bacteria may or may not cause a problem. It depends on the pattern that we see, and it depends on the health of the rest of the microbiome. Okay, so there's 26 of these tested, and they include things like some of the really bad ones are the Pseudomonas, Morganella, Citrobacter, Klebsiella, Proteus. I mentioned those before because they all can trigger autoimmune disease. The Streptococcus, Staphylococcus, different bacteria like that we want to look at your levels of that. Some is not bad, but if you're really highly colonized, that can be a big problem. Pseudomonas aeruginosa is an interesting bacteria. It has certain virulence factors when they get turned on, has been documented to literally turn on the production of cancer tumors, specific type. But that's documented in the research. So having that particular microbe in your gut is not healthy. Okay. So the other opportunistic bacteria or microorganisms that it looks at are yeast. So that would be where you would look at your Candida and some other species like Rhodotorula and some other fungi. So we'd look at that. And then for infections, it also looks at 7 protozoans and 5 worms. Okay. We've only had a couple of people test positive for worms, but we have had that. A tapeworm egg was found in one patient, and whipworm was found in 2 other patients. So we definitely want to get rid of those worms. Those are really damaging. However, these protozoans, the 7 protozoans that the test for, they are parasites, but it's like they don't trigger disease in all people. Some people can experience diarrhea, bloating, things like that. And common parasites we look at here are called Blastocystis, Cyclospora, Dentamoeba fragilis. There's 7 altogether, okay? But typically when someone tests positive for one of these protozoan parasites, even if they don't really have symptoms a lot, most people are like, yeah, can we please get rid of that? I'm not interested in having that parasite in my body anymore. So they're not commonly found, but they're found more than you would think. Okay. So the test also, so those are the infections that it tests for. Now, one of the really neat things about this test is that it also tests your level of good bacteria, your healthy bacteria, the bacteria that helps modulate your immune system and do all these other good, healthy things that we were telling you about. So that helps crowd out the bad bugs, and it keeps your gut line, good bacteria keep your gut lining healthy. These good bacteria are producers of those short chain fatty acids, like butyrate that we were referring to earlier. And also the good bacteria in your gut, they're responsible for actually manufacturing certain vitamins, specifically like some B vitamins and vitamin K. So you need these good levels of healthy bacteria to make vitamins. This particular test measures 9 of these healthy bacteria and gives us the levels that you're at, so we can tailor your treatment to that. Like maybe you don't need a probiotic because you're good on lacto and bifido, but you're low in all the strains, the other strains, and we need to treat that differently. Hey Cindy, so I just got a question, what's the name of the test? So she just joined in, DSL, Diagnostic Solutions Laboratories, GI map. So that's the one that we use. All right, so that's the infections component of the test and the good bacteria of the test. And Chelsey's now going to talk about the digestive markers that this test also looks at.
Okay, so another big benefit of this test is it gives you an idea of the state of health in your gut, which is largely determined by your microbiome, but very important. So the first thing it takes a look at is how well is your pancreas doing its job of helping digest food. So the pancreas has two roles. One's making insulin, the other's making digestive enzymes and bicarbonate. And so this test measures one of those enzymes that is independent of whether you're taking digestive enzymes, which is really neat because some people say, well, if I'm taking digestive enzymes, will that affect the test? No, this is only intrinsic pancreatic enzyme. If these levels are low, you know that there's a difficulty breaking down food and your pancreas isn't working at optimal levels, and we need to support it. So suppressed pancreatic function, low stomach acid, which we find a lot, certain diets, and cystic fibrosis. So the next thing it checks is steatocrit, which is how much fat is in your stool. So I don't know if you ever heard as a child, if your poo floats, that's a bad thing. Too much fat in your poo will make it float, sometimes, not always, and that's always a sign of malabsorption when you have too much fat. There really should be almost none. But particularly high levels means your bile salts are not emulsifying fats. You're not getting fats digested, and then some people may think that's a good thing. Like there used to be those drugs to prevent you from absorbing fat, but you actually need this for hormones. You need it for cell membranes. You need it for your brain. Like you need your fat, and so
good fat, healthy fat.
So the reasons that this could be low, high, too much fat, could be low stomach acid, pancreatic insufficiency, liver gallbladder insufficiency, bile salt insufficiency, and then eating on the run, not chewing properly, not starting the digestive process properly, eating under stress, that type of stuff. The next thing is beta glucuronidase, and this is produced by dysbiotic microbiome. It's elevated when the dysbiosis becomes moderate to severe. Really high levels can actually indicate colon cancer, and we have seen this with a few patients. Also, when the liver is having difficulty metabolizing toxins, especially hormones, this level tends to elevate. So when we see this high, we support liver. And if it's really high in connection with the next one, occult blood, we usually refer to GI to rule out any of the scarier things. Occult blood in the test showing up, a lot of people wonder, could that just be a hemorrhoid or menstrual blood or something? The way they measure this blood, it's the hemoglobin attached, so it's less likely to produce false positives. It's usually indicative of bleeding up higher in the GI tract, higher in the colon or in the stomach. If we find more than a certain threshold for occult blood, we suspect inflammatory bowel disease, ulcers, diverticulitis, polyps, or colon cancer. Secretory Iga, we've been talking about this since the beginning of these talks 6 weeks ago. So this guy is your first line of defense. We said that before, really, really important to your immune system and colon health. If Secretory Iga is low in the stool, then the gut's not making enough. And this is actually even more accurate than blood levels to reflect what's going on with Iga in your body. It's a loss of your mucosal barrier defense. We see this with the dysbiotic microbiome. We see this with chronic stress. We see this with suppressed immune function. When it's high, it means you're likely fighting an acute infection. When it's low, like what we just spoke about, also can be high with certain types of food sensitivities or food allergies. So we definitely address that when we see it. Anti-Gliadin Iga is a sign of gluten intolerance in the gut. So if we see that, we would explore that further. Is there issues with gluten going on? Calprotectin is the gold standard for measuring inflammatory bowel disease. They actually use this in mainstream medicine with GI doctors. High levels of inflammation in the bowel are bad. We talked about that throughout the talks. If this is high, we suspect neutrophil infiltration, immune system activation, infection, food allergies, sensitivities, diverticulitis, and cancer as well. And then finally, zonulin is a protein that's released when the tight junctions in the colon open up. So they're only supposed to open a little bit at certain times to release nutrients. When they open too much, too early, and the big particles of food come out, we have what you call leaky gut. We've talked about that a few times too. So zonulin is an indicator of progressing leaky gut. So when we find that, we have a set of things that we do to address that as well.
Yes, so we're going to talk about, so we hope from that you guys can see how comprehensive that test is. So it really helps us to look at the overall patterns of the gut, the infections, what's there that shouldn't be, and in how much abundance is it there, the good bacteria, how healthy is the good bacteria of the gut, and then what's going on, how has this impacted the digestive capacity, the absorption capacity, how has it affected your gut immune function, and what level of inflammation has it created or not in the gut. So that test is super comprehensive, and we would strongly recommend anyone who just wants to be proactive about their health to really explore their gut microbiome. So we are going to just finish up here with saying, okay, well, what do I do with these results? So, and one of the reasons we wanted to do these videos is because we spend a lot of time with our patients in the treatment room, but it's always focused on, what's going on with them, right? We don't really ever have a chance to explain like in detail why we recommend some of the tests that we recommend and what goes on behind the scenes, right? In terms of us understanding how your symptomology, you might think you came in for sinus congestion or, cognitive impairment, and we're suggesting a gut microbiome test. And, it takes, we're looking at an hour just to talk about all the reasons, and we barely scratched the surface. So that's another reason why we just wanted to get on here and help people to understand, more about how their gut microbiome affects their entire health. So what do we do with treatment? All right, so we're going to bring it home with this. In functional medicine, there is I guess you could almost call it like a standard of care into how you treat, how you help heal the gut microbiome. Okay, and typically, depending on what's going on, for a time frame, this typically takes like 3 to 6 months on average, right? Severe cases, lots of autoimmune diseases, things like, that may take a little bit longer, but for the average person, it's probably a 3 to 6 month process. So the functional medicine approach to gut health treatment is called the 5R method. Okay, so the 5R method stands for, and this is sort of the order too that we look at, is remove, replace, reinoculate, repair, and rebalance. So we're going to look at what each of that means. So the first step is remove. Okay, so that means we have to remove the offending or overgrown dysbiotic bacteria, yeast, parasites, any of those types of microorganisms that are compromising the person's health, right? And we also would want to remove any offending foods, because as we talked in our food sensitivity talk, food sensitivities also drive inflammation. So we want to give this gut a chance to really heal, and it can't do that if it still has these overgrown bacteria and or inflammatory foods, compromising its integrity. So typical, we would look at and also what's interesting is in the world of nutritional supplementation and herbal medicine, the particular gut bacteria or yeast or fungi, it's not a one size fits all kill approach, right? So we remove by using antimicrobial herbs and nutritional supplements that have shown to have efficacy to eradicate or kill these bugs. But we have to tailor them. So what kills yeast more effectively doesn't necessarily kill H. pylori or other bacteria. So some of the common things that we use would be oil of oregano, black walnut, olive leaf extract, mastic gum, caprylic acid, things like this. Okay, these are your herbal antimicrobials. But the thing is, they have to be given in therapeutic doses, and the right ones have to be given in order for them to be effective. And this is not really, we like to call them kill cycles, okay? These kill cycles are not to really be taken lightly. So you really want to have the guidance of a practitioner for this, because when you kill off, depending on how high your levels were, if you were really riddled with yeast, when you start to kill off that yeast, these microorganisms start to release toxins, enterotoxins, right? And they sort of, as those bacteria die, they degrade, and their endotoxins, what's inside them, spill out into the host's system, and can cause inflammation, can cause people to feel a little flu-like-y almost,
definitely,
or just
grumpy,
irritable, headachy, fatigue. Again, that depends on how high your levels are, but it can definitely happen. So that needs to be monitored. It's not something to be taken lightly, because herbal antimicrobials are just as effective in many cases, in many situations, as traditional antibiotics. So you want to, but they just don't have the downstream effect of killing off the good bacteria, which is super important, right? They can kill the bad while leaving the good relatively untouched. Okay, so that's your remove. That's what we do first.
Okay.
Typically first, I should say. I mean, I said that and then I was like, sometimes the person needs to get their stress under control, or they need to do other things before they're strong enough to take on a kill cycle. So I should retract that and say it depends on the person, but most often we do remove cycles first.
Okay, and then second or concurrently, replace. So if we find a deficiency in digestion, if we find that the microbiome or whatever has impaired absorption, pancreatic function, liver gallbladder function, stomach acid is too low, anything like that, we have to support the digestion to help get healing to occur. So we do this with digestive enzymes. We use that if the pancreas is not working properly. We use bile salts if we notice that there's too much fat going on. Plant-based bitters also help with low stomach acid situation, or if we need to directly use hydrochloric acid. And then liver and gallbladder support if it seems like they are struggling. So that would be the replace phase to support absorption, digestion.
Yes. Okay. And so the third R is re-inoculate. So what does that mean exactly? That means when we're giving back the gut microbiome what it needs in terms of its good, healthy microorganisms, right? So this would be, we do this with probiotics and prebiotics. So your lactobacillus, your bifidobacterium, we usually use therapeutic dosings in the beginning of anywhere from, on the low end, probably 30 billion in CFUs, colony forming units in one capsule, upwards to 50 or 100 billion, depending, sometimes more, depending on what's going on with that particular patient. Prebiotics, they can be given in supplement form if necessary. Beta-glucans, inulins, fructooligosaccharides, pectin, arabinogalactans. These are typical prebiotics. Prebiotics feed the healthy bacteria to help them make more short chain fatty acids. So the only probiotics that survive the gut, right, the transit through the hydrochloric acid in the gut, is essentially when you have a well-designed probiotic and you have certain bifido and lactose strains. Those are the only two that can really be replaced or supplemented. All the other healthy strains have to be encouraged to grow and proliferate on their own, and that's where prebiotics come into play, or decreasing your stress, or improving your diet, eating more fiber. That's how you're going to feed these other strains of good bacteria that you need to grow. So sometimes people have said, oh, I tried a probiotic, it didn't do anything for me. Well, yeah, that's not the only answer. It's certainly a very small piece of the puzzle. Think about it like this. If you had you wanted to have a garden, okay? And you just went out there it was plot of weeds, right? And you just went out there and you sprinkled some seeds, some flower seeds right over the top of it. And you come back and you're like, well, why didn't my garden grow, right? It's like, you can't. The weeds are going to choke it out. So that's what happens in your gut. The terrain inside your gut microbiome is no different. If you just take a probiotic, but you got a belly full of weeds in there, okay, that they're not going to be able to seed. They're not going to be able to take root. So you have to clean out the weeds. That's the remove, right? That's that remove first step in order for these probiotics to do their job, right? And also there's a new field of spore-based probiotics. That's a whole nother topic, but that's something that you should decide on together with your healthcare practitioner. But understand that just simply taking a probiotic is not the answer. You have to understand what is happening with the gut microbiome on the whole. Sometimes we also use a good probiotic yeast called Saccharomyces boulardii, which helps to crowd out bad yeast like Candida albicans, and also has been competitive with C. diff. So interestingly, how Saccharomyces has been researched and documented to help people with C. diff. So we use that quite frequently in the office because it has a lot of benefits.
Definitely. And so some of my patients have actually said, and not necessarily the probiotics we use, but some, I took a probiotic and I got diarrhea or upset stomach, or it really bothered me. I think that's a sign that there's possibly more going on in there that needs to be addressed before you try to take the probiotic.
For sure. Also, I'm going to God, I can't just not say it. Okay, so I just can't not say it. I tried. But certainly also people with SIBO, or small intestinal bacterial overgrowth, again, which is a whole topic of its own, all right? But a lot of these people, they don't have the overgrowth or the dysbiosis in the large intestine. It's in the small intestine, okay? And when they take a probiotic, which is always got lactobacillus in it, they ferment the lactose in the sugar in that milk sugar in that probiotic, and they get worsening of symptoms. So their bloating becomes worse. They generally feel worse. So if you have that happen to you, it may very well be that you have SIBO, or small intestinal bacterial overgrowth, or CFO, which is small intestine fungal overgrowth, and not a problem in your colon. Whole different talk, but I had to say it because it's important about why
a lot
probiotics don't work for some people.
Yeah.
Okay.
So then repair, if we have a leaky gut, suspect a leaky gut, zonulin's elevated, we need to do a repair to the mucosal lining of the colon. So we use a variety of supplements. L-glutamine is probably the most well-known, aloe, the inside, not the outside, cat's claw, marshmallow, and colostrum we found to be very effective in repairing leaky gut. So in the office here, our favorite is a formula called GI Revive that has about 9 of the best gut healers in therapeutic doses. And then we also generally add colostrum, especially if IgA is low.
Yep.
And then we, in the process of repairing, which hopefully we've done in all the cycles ahead, we want to remove the thorn, remove the issues that are causing the inflammation that contributed to the leaky gut, so the dysbiosis or the food sensitivities or anything else, toxins, etc.
Great. So we have number 1, remove. Number 2, repair. Number 3, reinoculate. Right. Number 4. Remove, replace, reinoculate, repair. And number 5 really is the thing that is going to be the most important to help you maintain a healthy gut for the long term, right? Because you could kill it doing all those 4 steps and do all the right things. But if you don't do the 5th step, which is rebalance, okay, all of that could just be temporary in changes and improvement. So rebalancing means decreasing those stress levels, lifestyle changes to help keep these improvements that you've made. So these things, the simple of the things: sleep, right? Adequate rest, diet. We've already talked about it, but it's crucial. That doesn't mean you can't splurge every once in a while, but you can't eat this high fat, high sugar, super high protein processed food diet and expect to have health for the long term. You just can't. So stress management, these are critical to maintaining a healthy gut. So some things that you can do at home for rebalancing: meditation, yoga practice, even just 15-20 minutes a day, but do it consistently, right? Mindfulness practices, Tai Chi, Qigong, anything like that helps to just rebalance and recenter the mind. That's what is going to be important for maintaining long-term gut health, right? And then here in the office, we can help you with stress management tools and techniques and things that lower the sympathetic nervous system stress response through acupuncture. It's great for that. And for NET, we had a different talk about neuroemotional technique, but that really helps to deal with the unresolved stress and emotional issues so that the gut calms down, you calm down, and stay that way, right? So we have one question. Does insurance cover any supplements, or is the cost out of pocket? Unfortunately, there is no insurance plan, period, in the U.S. right now that we know of that covers supplements. However, if you do have a health savings plan through your an HSA, through your place of work, these are covered through that. So you can utilize your pre-tax dollars in things like health savings accounts to offset the cost of supplements. Good question. But do remember that if you do have Medicare, the test itself is covered, and that's like a $400 value right there. Yeah. So that's a huge savings if you're a Medicare patient. So to wrap it up, thank you guys for watching. If we had to pick one test that we ourselves have both done and had issues that we are working on, that we would encourage all of our patients to do to just truly understand what is going on with their gut and what their risk is for their long-term health and how they can do something about it, it would be the gut microbiome.
Absolutely.
And you would agree.
Absolutely. I worked with a functional medicine doctor for years before joining Angela and got exposed to a lot of these tests and have been passionate about a lot of these tests, but I would say hands down for 90% of my patients, if I could only choose one, it would be this one.
Yeah, for sure. So,
and one quick thing, it's important to retest.
Oh yeah.
We do
Retesting.
see positive changes when people do this stuff.
For sure. And sometimes, that's the thing. Sometimes it's like, bam, and it's like that's exactly what they needed. They did a treatment plan for anywhere. The first round, that's a good point. The first round of treatment is usually anywhere from 8 to 12 weeks, I would say, for the beginning, depending on what's going on with the patient and how long they've had the issues. And then we typically retest around that 10 to 12 week time frame. We see what's improved. We see what we need to keep doing that's working. And then we see, is there something that, we're still struggling with? Some of the Pseudomonas is one of the ones that I'm really working on right now because it can be difficult to eradicate. It creates a biofilm and it knows how to protect itself. And that's one thing that can be difficult to work with. But because of the risk of having Pseudomonas and cancer, we are going to keep going after that until we get rid of it. So if you are a existing patient and you've never had the GI map done before, all you would need to do is just call the office, let them know, and we can have you come by and do a no contact pickup for the kit. If you are a new patient and you've never done this before, then all you would have to do is call the office. We would set up a telehealth. We can do telehealth for this to evaluate you, document your need for the test so that we can bill your insurance, things like that, and have you on record so that we know what your issues are. And then we can either mail you a kit if you're not in Vero. Right now, the telehealth guidelines have been relaxed across the nation due to COVID. So typically you can't practice across state lines, but that has changed right now for the time being. So great time to utilize that. And then you do the test. And then when your results are in, we can do telehealth for follow-up. So right now, all this can be done by telehealth just to keep, social distancing measures in place if the patient prefers that. So, oh, I just answered that. Wow. Okay. There was a question about long distance, but yes, we can definitely do that long distance right now. So now's the time to do that. We can mail the kit out to you and have you go up and just when your results come in, we set up an appointment to go over it and give you our recommendations. So any questions? If we'll stick around for questions, if anybody has any questions. And if not, we certainly thank you for your attention today.
I forgot one more thing.
Chelsey has one more thing to say. We can't stop talking. We could talk about this for days.
Because Big Brother definitely listens in. This week, as I was doing a lot of the research for the most recent studies about the microbiome, Facebook began targeting me with at-home stool tests that you can buy yourself over the internet.
Crazy.
So just a word of caution. We don't know all of them and how they work. Some of them may be okay. But you often get what you pay for, or you may pay a lot for one that doesn't have an accurate testing methodology or test all the things that are important to know, and then you may be relatively on your own trying to navigate what to do with the results. So just consider that carefully if you're getting targeted for these ads.
Right. This is not something that you want to undertake on your own. It just isn't, right? There's just too many steps and too many variables. So thank you guys. And if you're on Facebook, please share the video if you can and take a moment to like our Indian River Acupuncture page and like our posts. Like I feel like I have to say that now so that we are doing the right thing. Oh, YouTube. Yeah, thanks. So this video, I know it was long and there may be a lot to take in. If you want to rewatch, it'll be up on YouTube by Monday, right? Mm-hmm. Yeah, by Monday, this video will be up on our YouTube channel, which is Indian River Acupuncture and Functional Medicine. The stress treatments, there's one more question. Is that covered by insurance? Depends. So with all insurance for our services, The best thing to do is call the office and talk to our billing manager. She's been with me for 14 years and she knows insurance inside and out. And so it depends on the particular policy, what your benefits are and things like that. So unfortunately, there's no one size fits all answer to insurance, but just have your insurance card ready, have your number ready, and then we can give you that answer that you're looking for. Thank you for tuning in today. Everybody have a great Saturday.
Thanks, everyone.
Bye.